A very good morning, friends. Today we will discuss about an important practical in biochemistry, that is estimation of plasma glucose. This is a important practical. It is a quantitative estimation. We'll discuss this practical under heading of aim, specimen, method, other methods available, principle, procedure, observation, calculation, result, interpretation and normal range. From here onward, or for discussion of each practical, we'll use these headings: aim, specimen, method, other method, principle, observation, calculation, result, interpretation and normal range. The term plasma glucose should be used. Blood glucose estimation is a misnomer. So the term plasma glucose should be used. Plasma means there is presence of fibrinogen. It is absent in the serum. It is utilized in the process of clotting. All clotting factors, they are utilized in the process of clotting when we get a serum. In plasma, there is presence of PP, plasma presence of fibrinogen. Now, how will you get a plasma? To get a plasma, collect a blood in a vial or tube that is known as fluoride bulb. Fluoride bulb. Now, what are the composition of fluoride bulb? It contains potassium oxalate and sodium fluoride in the ratio of 3:1. And quantity required is 4 milligram per ml of blood. This is required because in RBC there is continuous glycolysis, and due to the continuous glycolysis the sugar level or glucose level will drop down by the rate of 5 to 10 milligram per deciliter per hour. To prevent this combination potassium oxalate and sodium fluoride is used. This sodium fluoride inhibits the enzyme enolase. This is the enzyme of glycolysis which catalyzes the conversion of 2-phosphoglycerate to phosphoenol pyruvate. Fluoride ions, these are the metal ions. These ions non-competitive inhibition. Non-competitively inhibit the enzyme enolase and hence glycolysis. As glycolysis is prevented, sugar level or glucose level will be maintained in a sample. And this potassium oxalate, it is an anticoagulant. So this is the role of fluoride bulb. Now coming to the method. There are two methods or two main types of methods which are available for estimation of plasma glucose. The first one is the methods which are based on reducing property, that are known as chemical methods. They are based on reducing properties. And another one is enzymatic methods. Now these methods are hugely replaced by the enzymatic methods. Still they are in use in some UG laboratories. They are based on reducing property. The most common method is Foligno method. Foligno method. Then another method is King-Asatur method. And third one is the Nelson-Somogai method. So these are the chemical methods available. For the Foligno, we require a special tube. This is a Foligno tube which is required for estimation of plasma glucose. It requires special environment. Water bath is required. So special tube is required for this chemical method, that is known as Foligno tube. Then water bath is required. Then preparation of protein free filtrate is must for the estimation of plasma glucose by Foligno method. Then it is a complicated procedure. Foligno method is a complicated procedure as compared to the enzymatic ones. Enzymatic methods are specific because enzymes, they are specific for their substrate. Second, single step procedures are there. Single step procedure means take a working reagent, add a plasma to it, you will get a result after 15 minutes. So specific, these methods are specific, single step procedures are there, only 10 microliter of sample is required. And these methods, enzymatic methods, they give true value of glucose. These reducing methods, they give 20% extra result, especially Foligno. Because other reducing substances which are present in blood, they give this test positive. For example, glutathione, then vitamin C, uric acid, threonine. These are the substances which gives this test positive. So enzymatic procedure, they are best because enzymes are substrate specific and they give true value. These are the two main reasons. That's why these methods are hugely replaced by the enzymatic methods. Now coming to the method of estimation, we'll discuss here GOD-POD method, that is glucose oxidase peroxidase method, which is used in most of the places. It is used, that is glucose oxidase peroxidase method. Now in some places, our higher institute or tertiary care centers, it is replaced by the hexokinase method. So these are the two specific methods which gives true value of glucose. They are now in use. Now coming to the glucose oxidase peroxidase method and hexokinase method. Now coming to the principal part, first we will see the glucose oxidase peroxidase method. According to this method, beta D glucose, which is present in the plasma, it is acted upon by glucose oxidase to give D-gluconic acid and H2O2, hydrogen peroxide. This H2O2, it is acted upon by peroxidase to give water molecule and nascent oxygen. Now this nascent oxygen, it combines with 4-amino antipyrine, 4-amino antipyrine plus phenol to give a red colored compound, that is quinone imine dye. So red or pink to red quinone imine dye, which red colorimetrically at 530 nanometer, that is a complementary color filter, that is green color filter. So this is the principle of glucose oxidase peroxidase method. Hexokinase method, it is in most of the tertiary institute, it is now used, that is known as hexokinase method. In this method, glucose, which is the first step of glycolysis, that is glucose plus ATP in presence of hexokinase, it gives glucose 6-phosphate plus ADP. Now this glucose 6-phosphate plus NAD in presence of glucose 6-phosphate dehydrogenase, it gives NADH. It gives NADH, and rate of formation of NADH is measured at spectrophotometer, that is 340 nanometer. So this This procedure requires spectrophotometer. Rate of formation of NADH is measured here. So these two procedures, that is glucose oxidase peroxidase method and hexokinase methods, they are easy to set on autoanalyzer. That's why they are preferred method now and they give true value. Another small instrument is available, that is glucometer, which is based on dry chemistry and ion selective electrode property. So it gives correct value of blood glucose, capillary blood glucose. So this is about the principle of estimation. Now we'll discuss the principle of Foligno method in short, because in most of the institute this Foligno method, it is in use. Some institute it is in use, that is Foligno method. The principle is glucose in hot alkaline medium, which is provided by NaOH, hot alkaline medium, glucose is converted into NADOL. NADOL, it is a strong reducing agent which reduces these cupric ions into cuprous ion, and there is formation of cuprous oxide which reacts with phosphomolybdic acid into molybdenum blue. So blue color is there. Glucose in hot alkaline medium give NADOL, which reduces cupric ion to the cuprous ions, and simultaneously there is conversion of phosphomolybdic acid to the molybdenum blue, which read colorimetrically. So this is the principle of Foligno method. Now coming to the procedure, that is procedure of glucose oxidase peroxidase method. We'll take three test tube, label these three test tube as test, standard and blank. Two types of blanks are there. First one is the distilled water blank, that is to adjust the zero in colorimeter. Second blank is the reagent blank. This is the reagent blank. This is to nullify the color of reagent. Reagent blank is to nullify the color of reagent. In the test tube or T-labeled tube, take 10 microliter of sample, that is plasma. Take glucose standard of concentration 100 mg/cent in the standard tube, 10 microliter. Standard means the solution with known concentration, which is used for comparison of result. And distilled water 10 microliter in the blank. And working GOD-POD reagent, that is GOD-POD reagent, it is 1 ml in each tube. This is the procedure. Incubate the tubes for 15 minutes at 37 degrees centigrade in the incubator, and take optical density at 530 nanometer in a colorimeter. This is a endpoint method. Means optical density is measured after a formation of color or after a stabilization of color. After that, if you take a OD after 5 minutes, 10 minutes, the OD will remain same. That is known as endpoint method. So this is procedure. In observation, just record optical density of test, standard and blank. Now calculation. Calculation is simple. Plasma glucose in milligram per deciliter is equal to OD of test minus OD of blank, OD of standard minus OD of blank into concentration of standard, that is 100 milligram per cent. So this will give you your result. Suppose the result is 100 milligram per deciliter. The result will be the plasma glucose was found out to be 100 milligram per deciliter. This is your result. Now normal range, then we will see the interpretation. There are three types of sample. First one is the fasting. For the fasting, you have to take a sample after a 12 hours of overnight fast. Sample is collected after a 12 hours of overnight fast. Patient is asked to take a dinner at 8 p.m. in the night. Then nothing is allowed. In morning, ask patient to come in the morning. Before taking any beverages, tea, coffee, only water is allowed. And sample is taken in the 8 a.m. morning. That is known as fasting sample after a 12 hours of overnight fast. Post meal or postprandial sample means 2 hours after standard lunch or 2 hours after 75 gram of glucose load. That is known as post meal sample or postprandial sample. And random sample means anytime. Sample connected anytime irrespective of status of meal. That is known as random blood sample. Now normal values according to these samples. Fasting value is 70 to 110 milligram per deciliter. Deciliter means 100 ml or milligram per cent. Postprandial value is 110 to 140 milligram per deciliter. And random is 70 to 140 milligram per dl. These are the normal values: 70 to 110 fasting, 110 to 140 post meal, 70 to 140 random blood glucose or plasma glucose value. Now coming to the interpretation or clinical, means our result was 100 milligram per deciliter. According to this result, it is a normal plasma glucose value, but we don't know the status of the patient, whether it is fasting, post meal or random. Considering random, it is a normal plasma glucose level, 100 milligram per deciliter. Now we'll see the clinical significance. In clinical significance, if plasma glucose is more than the normal range according to fasting, post meal and random, it is known as hyperglycemia. Hyperglycemia means increase in the blood glucose, increase glucose level above the normal. That is known as hyperglycemia. The important condition, all of you know the important condition in which blood sugar level increases. The condition is diabetes mellitus. Three cardinal symptoms are there: polyuria, polyphagia and polydipsia. So diabetes mellitus is the first. Then hyperactivity of all three glands, hyperactivity of thyroid, pituitary and adrenal gland. Steroid therapy, and raise intracranial tension as in meningitis, encephalitis, CNS tumor, etc. In that condition, the blood glucose level value will increase. So these are the conditions: diabetes, hyperactivity of three glands, prolonged steroid therapy, and raise intracranial tension as in meningitis, encephalitis, tumor of CNS, etc. Now hypoglycemia, when blood glucose level below 60 milligram per deciliter, it is known as hypoglycemia. The most common cause of hypoglycemia is the incorrect dose of insulin. So, incorrect dose of insulin or skipping of meal after taking a insulin. This is the most common cause of hypoglycemia. Then second one is the hypoactivity of these three glands, means decreased activity of pituitary, thyroid and adrenal gland. Then third one is the malnutrition, malabsorption, insulinoma. These are the conditions in which blood glucose level decreases. So this is all about the glucose. Summarizing the all, the special precaution is you have to collect a blood sample in a special tube that is known as fluoride bulb. It contains sodium fluoride and potassium oxalate. Then most commonly used method is glucose oxidase peroxidase method. Then there are three types of sample: fasting, post meal and random. Normal range 70 to 110 fasting, 110 to 140 post meal and 70 to 140 random sample. For the diagnosis of diabetes mellitus, there is a criteria. If the fasting sample value is more than 126, it is known as diabetes. If random value is more than 200, it is known as diabetes. The fasting value in between 110 to 126, it is impaired glucose tolerance. And post meal value in between 140 to 200, it is known as impaired glucose tolerance. Renal threshold for glucose is 180 milligram per deciliter. This is all about the plasma glucose estimation. Thank you. Keep watching.